Hello, my name is Robin Swiffer, and today I'll be talking about cystic fibrosis. Well, what is cystic fibrosis? I'm going to call it CF for short. It's shortening the name. It's a genetic disorder, which means you get it from your parents at birth. It affects your body and it makes mucus, a substance that helps the organs and the systems work. Mucus should be thin and slippery. But when you have CF, they become thick, glue-like. This blocks the tubes and ducts throughout the body. Over time, the thick mucus builds up inside the airways, which makes it hard for some people to breathe. And the mucus traps germs, which leads to infection. And it also can cause severe lung damage, like cysts and fluid-like filled sacs and fibrosis, which is scar tissue. How does CF get its name? We wonder that. CF, cystic fibrosis. Well, more than 30,000 people in the United States alone live with cystic fibrosis that are diagnosed every year, over 1,000 cases. Well, we wonder, what are the symptoms of cystic fibrosis? You know, trouble with bowel movements or frequency, greasy stools, wheezing, or trouble breathing. You know, there's frequent lung infections, infertility, if you can't have children, or having trouble having children, especially in men. Males are high in that. Trouble growing or gaining weight, skin that tastes very salty.
Here we go.
No, wait a minute. What is the cause of cystic fibrosis? Cystic fibrosis is caused by a change, or let's call it a mutation, in a gene called CFTR, which stands for Cystic Fibrosis Transmembrane Conductance Regulator. The gene controls and flows salt and fluids in and out of the cells. If the CFTR gene doesn't work the way it should, a sticky mucus builds up in the body. Okay. To get CF, you have to inherit a mutated copy of the gene from both of your parents. So not just one parent, just it has to be both in order to retrieve this disease. If you inherit only one copy, you won't have any symptoms, but you will be a carrier of the disease, which means there's a chance you could pass it along to your children. So it's very important to get tested. About 10 million Americans are CF carriers. Every time 2 CF carriers have a baby, there's a 25% chance, a 1 in 4 chance that their child will be born with CF. The best way to do this is to get an early diagnosis. Early diagnosis means early treatment, better health later in life. Every state in the U.S. tests newborns for cystic fibrosis using one or more of these tests. Something like blood tests, the tests that check the levels of blood tests that check with levels of IRT. People that with CF or have higher levels in their blood. DNA test, it looks for mutants for the CFTR gene. Sweat test, it measures the salt in the sweat. Higher normal suggests that you have CF. Yeah. Some people who weren't tested at birth aren't diagnosed with CF until they become adults. The doctors might give a DNA test or a sweat test if you have any of the symptoms of the disease, but it's always best to get tested for everything. The best way for treatment for CF, because there's no cure for cystic fibrosis, but medication and other therapies can ease the symptoms. Medication, your doctors may give you drugs to open your airways, thin the mucus, prevent infections, help your body get nutrition from food, These include antibiotics. They can prevent and treat lung infections and help your lungs work better. You might give them as pills or inhaler or a shot. An anti-inflammatory medicine is also one of these treatments. These include ibuprofen, steroids, or mucus thinners, CFTR modulators. These help with them. Airway clearance techniques, chest therapy or percussions, oscillating devices, and that's the best form of treatment for CF that you can find. Thank you very much for your time.